So today we're going to assess the GI system. I've got my patient here. She's sitting with her knees slightly bent and her head at a 35-degree angle just to loosen the abdomen. And I had her go to the bathroom first before we did this so that she wouldn't be uncomfortable. I would have a tangential light here and I'd be looking at the abdomen from a couple of different views, just looking for symmetry, any distension, which I don't see any distension. I've seen that the skin is pink, warm, and dry on the belly. There's no aortic pulsations, and there aren't any abdominal scars or any umbilical hernias. So next I'm going to take a listen in all 4 quadrants. And I readily hear tinkling, light tinkling, normal active bowel sounds through all quadrants. So next I'm going to listen for vascular sounds using the bell of my stethoscope. First I'm going to listen for any bruits or in the aortic area. And next I'm going to listen in the renal. And I do that bilaterally. And then I'll find the hip here, and I'll do the iliac, and I do that on both sides, and then I've already done the femoral. So next I'm going to lightly percuss the abdomen just to hear how it sounds. In all the quadrants, and it sounds tympanic without dullness. Without dullness in the lower quadrant, so it doesn't indicate that there's any stool in there. Now I'm going to percuss for the liver, and I'm going to percuss until I feel dullness, and then I'm going to keep going, and when that dullness ends, I'm going to mark it with a piece of tape on the border and measure, and I'm going to do that at the mid-clavicular line, and then I'm going to do that at the mid-sternal line. So we got my piece of tape here, mark out the top, and mark out the bottom, and then I'll measure that. All right, and so we measure that, and we see that it's approximately 8 centimeters in diameter, which is normal. So then we're going to do the same thing at the mid-sternal border. So I've got my piece of tape here. And mark the top, my second piece of tape, and mark the next, and then measure that as well. And we see that that's about 4 centimeters, so that's normal. And I'll remove this tape. All right. Next I'm going to percuss to find the spleen. So I'm going to percuss at the anterior axillary line around the 6th and 7th intercostal space. And so we've found the spleen. And next I'm going to palpate the abdomen lightly, and I'm just going to make sure that I don't see any grimacing on my patient's face. They're not telling me that they're having any pain while I'm palpating, and just keep an eye on that. You feeling any pain?
Nope, no pain.
All right. Okay, so no pain, everything's normal. I'm not feeling any nodules or any areas of concern. Okay, so now I'm going to palpate to see if I can feel the liver. So what I'm going to do is I'm going to use a hooking technique, and under the right rib, I'm going to have my patient go ahead and take a nice deep breath in and then out. And I'm just feeling to see if I can feel the liver at all here. And I would say that it's non-palpable. And then I'm going to do the same thing over here on the left side to palpate for the spleen. So again, right under the ribs here, I'm going to have my patient go ahead and take a nice deep breath in and out. And I would say that the spleen is non-palpable.